All right, so welcome to our grand rounds this week with Ottawa River Integrative Mental Health. And today we have a very cool presentation by John Hill, and we'll be talking about psychedelic-assisted group therapy for first responders. As a little bit of an intro, John is the co-founder and director at Empower Psychedelics, a federally registered not-for-profit organization establishing access to psychedelics for medical professionals in Canada. Empower Psychedelics is working with the government and industry to push legalization forward, performing the necessary clinical trials to publish data that Health Canada will use to adopt these therapies into medical practice. The current clinical trial in progress is a psychedelic-assisted group therapy program using psilocybin for first responders. This has been approved by Health Canada and is currently in the scheduling and recruitment phase. Today, we'll be discussing the Health Canada approval process, some of the challenges past and present, how the project got started, and where Jonathan and Empower Psychedelics plan on taking this into the future. So with that, I'll turn it over to you, John, and you can get started.
Thanks. Oh, now is it okay if I share my screen? It says that it's disabled. I've got a little presentation that might be helpful.
Let me see if I can enable that for you. Do you want to try requesting it again?
It still says disabled.
Okay.
I'm happy to just yap away, but the imagery is a little nicer.
I just have to change something here.
I think if you make him co-host, he'll be able to access all that.
Okay. Apologies for this, everyone. Well, it's turning out that I'm not smart enough to figure this out.
Kevin, is it to share the permissions to share screen?
Yeah, just go to over here. Look at the whole group.
Where? Here?
Here, click on, if I can grab it, sorry.
Yeah.
Boop. And then we want, where's John? We'll make him host. Come on.
All right, thanks, Kim. Sorry about that. And it looks like, John, you're the host now, so you should be able to do everything.
Okay, great. Thank you. Confirming you can see my screen. Hey,
Yep.
Heidi, I'm about to give this talk. We'll find Baby Bunny after. Trying to find her bunny. Okay, hi everyone. As mentioned, co-founder director at Empower Psychedelics. The mission statement for the organization was to establish access to psychedelic assisted therapies for medical professionals in Canada. And how we have had to go about doing that is by going through Health Canada to gain approval for a clinical trial, which must be performed. And then this must be measured by Health Canada in order to determine whether or not there are efficacies on their mind for this, not only medicine, but also the program, ours being a group therapy program, which I'll explain further. So that process, it's been a 5-year effort. The organization started at the beginning of 2020. The idea was to try to bridge the gap between the manufacturers of these psychedelic products and compounds that were currently in the market at the time, and the medical professionals that would eventually be using them for a variety of different ways. That being, that psychedelics typically have been thought of in this, clinician to patient environment. And I also got a couple cats running around too. That is perhaps outside of what the recreational, so to speak, psychedelic experience is typically encountered. And so there is a way to perhaps bridge these two worlds, and we hope that our clinical trial can help to do that, not only in the sense of being a group therapy, but also our clinicians have the agency to take the patients outdoors, which is really important. And I believe that there's something very powerful that needs to be captured here as part of this clinical trial process. And as we unfold these group therapies into other contexts, currently this clinical trial that we have approval for is for first responders with depression. Now, originally we had more strict exclusion and inclusion criteria, and needed to open it up out of necessity for recruitment. And we had seen other clinical trials not be able to follow through by having too strict criteria. So we have opened originally what was meant to be just for firefighters is now for first responders in general. We set the stage for the organization and what was ultimately this clinical trial approval by launching a observational research study in 2021 that was primarily responded by first responders in Canada, but also from around the world, from a variety of disciplines. That research was published a while ago, but has been recently brought out again. Some of that information is available on the Maps Canada social media currently. But what we found was that the most current intended interest for psychedelic assist therapies, and also current use cases and practice personally, was coming from firefighters. And so we decided to make this cohort of people our audience in which we would address this access to psychedelics as a patient population, deserving champions of what we see as this new psychedelic renaissance, so to speak, that is happening, the transition to legal applications. And so we believe this community of firefighters, first responders, co-founder Nigel Smith, he was a career firefighter before he started his doctorate. So it's close to us, and we have a large community and backing here, particularly in British Columbia and also in Ontario. And so we hope to expand this group therapy program access to the public service first responders. But of course, this is going to require assistance and support from the government. And so we went through the MyTax program. I've got some more information on this in future slides, but we went through the MyTax program, received approval through MyTax Accelerate for this. It was a $200,000 approximately overall grant. And that ultimately, with that observational research and the team that we have built, set the precedent for us to receive this approval for this very unique clinical trial. So it's been a 5-year effort for us to get this letter, essentially, that says we can get started. And so, yeah, realistically, we are just at the starting line, but it is exciting because, yeah, there's a great change to be made here. So as mentioned, ethics approved, we've got our letter. We now have to have our site investigation. And then we've already got a pretty steady body of interest, but the formal recruitment process will actually be beginning in Q1. And sorry, that should actually say 2026 in my presentation. So ultimately, we are likely going to end up making this entire protocol and what we're establishing here open source and through academia. We're in the process of following through on that right now with our current MyTax Accelerate cohort. Sorry, Heidi, can we not play the flute right now? Thank you. So, sorry, I lost train of thought. So right now we are currently in the process of working with the University of Quebec and Montreal and also our colleagues at the University of Toronto to plan for this clinical trial 3236N, but also for what will end up being the expansion of this. Ultimately, the 36N is not statistically significant or necessarily powerful. It's actually more out of budgeting constraints that we actually have landed upon this pilot data number to actually get this going. But ultimately, what we can anticipate, and based on meetings I've recently had within the government, is that we can expect that additional clinical trial work beyond this will be necessary. And we're looking at potentially hundreds of patients, multi-site study around Canada. And so we are this likely starting at the end of 2026 and in 2027. And so we are currently looking for additional colleagues, clinics, and academia to help support in that larger scale program. So we're thinking years and ahead for this because, yeah, as mentioned, we really are just getting started. So yeah, looking up that access to clinics, to authorized clinicians, it can be envisioned that the scheme that may exist in Canada in the future will be likely similar to that in Australia, possibly an opening up of our Section 56 exemption to authorized prescribers. So in this case, we can look and see what's happening there to determine approximately what might be happening here, but not for at least another 2 to 3 years realistically, unless there are some major sweeping changes of opinion within the government, which of course we are lobbying for at Psychedelics Canada. But yeah, it's a slow roll, this one. So this group therapy protocol is based around an organization that's from British Columbia called Gathering Groups. So they have established this years ago, have treated several hundred patients. So there's a significant amount of empirical evidence around this program. Yes, okay, thank you. So there's a significant amount of evidence already behind this program that we're actually ideally hoping to integrate into the investigation that will ultimately happen with Health Canada. But in the meantime, the clinical trial and the approval that we currently have is based around this Gathering Groups model. And I can say, having myself a significant amount of experience using psychedelics for recreational purposes, having gone through this program myself, it was truly eye-opening to understand not only the power of the group, but opening up yourself to this paradigm of being involved with others and feeling sensitive towards others and what they're experiencing as a part of this journey, which is something that I had really not a lot of experience before, and I truly could sense the healing power that not only from the medicine, which we're mostly aware of, but from the group and the support and the even the friends for life kind of thing. There was really such a bond there amongst peers, young and old. There were they've treated people in their 80s and young people in their 20s even, who have dealt with a significant trauma or life experience. And so to see this intermingling of generations and interests around this and the passion, and it's really inspiring. And I have the utmost confidence that the physicians and group that we have leading this will do a fantastic job in the future to continue to be stewards of this. And it's not easy. People are going through all sorts of things, and forgot to update this as well to timing to 2026, but to be able to go through that together with a group and to support one another within a group. There's truly something special there that is, I believe, unique to humanity and to the psychedelic experience that needs to be discussed and maybe as part of the societal healing process, which seems critical these days more than ever. So yeah, we do have some risks involved with this. We, as mentioned, recruitment, can scheduling and whatnot, it can potentially become an issue. So we do need to be well prepared for that in advance. The funding window is going to depend on how quickly we want to do this and which universities and academics are going to end up jumping on board. Originally, the plan was that we were going to try to do this ourselves, entirely ourselves, but it was simply too difficult to convince smart money that this was a viable investment opportunity. When I have tried to talk about Empower as a business, there seems to always be friction, and I don't like it, and it doesn't feel right to me. And when I otherwise approach it as a legalization engine and a force for good in this world, it seems to sit a lot better with people and with myself as well as founder. And so I believe that by us trying to make this open source and maintaining that integrity of the organization, it will be for the better. Yeah, perhaps keep us out of this corporate scheme that forces us to have high costs for patients and whatnot. Because right now the economics of all of this don't necessarily work for everyone. And considering having to spend millions of dollars on clinical trials to accomplish the same thing that we already have several hundred patients of empirical evidence for is quite insane. And so we need our government to be able to play fair and to want to adopt this, especially considering the necessity for public service workers. And so ideally, by going through the universities and these reputable institutions, our government will listen and will want to make that change sooner rather than later. So we originally tried to consider a special access program and a smaller cohort just to be able to publish data sooner rather than later. Health Canada basically told us, don't even bother. You're lucky that we approved your clinical trial in the first place. Please go do that. So we took that advice well and are now going through with the full 36-center clinical trial, which we had originally got approval for. More just about where we look to go with this. Ideally, clinics have access to this protocol through some sort of licensing that we adopt with the universities involved. And this enables either those authorized prescribers or a greater population of physicians to be able to perform psychedelic-assisted therapies. We hope that Empower Psychedelics may potentially act as a ombudsman or a layer between the government and these physicians to help possibly even on an insurance basis make sure that there's a safety net around the physicians involved and also where the risk lies, the government's certainly not going to want to take it or be responsible for it. And so I personally see Empower as playing a role there in the future once we complete this clinical trial phase of the organization. We've had fantastic support and partnerships. Everything started at CNS in Surrey, British Columbia. Through my Tax Accelerate program, we established a precedent for receiving funding from this program for psychedelic-assisted therapies, established those academic collaborations, now have a formal partnership with MAPS Canada. This was one of the goals of the organization when we started, was to have a partnership with MAPS Canada and for them to take us seriously in some capacity. For we certainly did look up to the work that MAPS Canada was doing when we started in 2020 and still do. And so now that's formalized, that's been a spark for myself and for all of us to to see this through to a bigger scale and yeah, try to make an impact here. It certainly hasn't been easy. This has put a lot of stress and financial pressure on me as I've funded all of this primarily so far. I have a full-time job. I'm an engineer by background, and that is I have continued to work full-time in my current job as all this has gone on. Would love to be able to work on this full-time in the future, but yeah, who knows when that is actually going to be. It could even be, years from now, potentially. Yeah, again, list of where we've already been, ultimately leading up to that Health Canada approval, and now looking at fully establishing that. And right, so we do have, I guess I didn't explain it earlier in this slide, but we do have an investment opportunity available, not necessarily relevant to this discussion here, but this is what is going to be required for the clinical trial. Currently, a BC Corp called Empower Research Inc. owns all of the intellectual property related to the name Empower Psychedelics and our logo. We have trademarks for that internationally now in several different jurisdictions. And that Empower Research Inc. also owns this protocol, which is being developed and by us and also approved by the government. And so originally the intention was that Empower Research Inc. as an organization would fund this entire clinical trial and perform all of this work ourselves. But as mentioned, yeah, it's been very difficult to get through to smart money without either having to give away the entire company essentially, or not being able to see through the risk, keeping in mind that there may be 100+ patient clinical trial ahead of us, costing millions of dollars, which is very scary. So I still have that in there. It is still relevant because we do have some ancillary investors and some people with high net worth individuals that are interested in the organization. So we're still mulling that out. But as I said in the past, trying to think of Empower as a business has always made me feel a little bit sick. And instead, would like to see it as a legalization vehicle, at the very least in Canada, but ideally throughout the Commonwealth. We've published the results of that that observational study in the Journal of Psychedelic Studies. That is finished available. I can share that, and a little bit more about our team. Nigel, currently completing his doctorate at the University of Washington, has been working on that for a few years now, completing his master's program and now his doctorate. And so he'll be leading all of our clinical applications for the company in the next couple of years. And then this is the team that we have in place from the Gathering Groups organization, and also named on the protocol here. Absolutely stellar people to work with. Couldn't give them enough praise for what they're doing, behind the scenes and putting themselves out there for this. And then, this explains how the organization currently exists. And the reason that we have structured it this way was Empower Research Inc. came first, with the intention of using this name, Empower Psychedelics. How are we going to do that? We registered the federal NPO, which set a precedent for using this name in Canada. That enabled us to win our trademarks for this logo and that name in Canada, and also the United States as a result for winning that in Canada. So it was more out of absolute necessity that we needed to also set up this federal NPO. But that being said, as this is the operating name and mission of the organization, we are now actually leaning more into this NPO as being the vehicle which will actually get this done over the next decade, and Empower Research Inc. Sitting quietly in the background as we figure out how to get through to smart money at some point, whenever that will be. This just again a little bit more about where we started, British Columbia. We have a lot of interest in Ontario and intend to have some sort of a sister clinic hosting this group therapy. And then we also have team members based in Ontario as well. So looking to expand into this region in the near future. Quick glimpse of where we live. Pretty neat space. This area that we see here is actually approved by Health Canada for use of clinical trials. We do intend to open up access to psychedelic medicines for different types of therapies, such as physical therapy in the future. This is one of these fringe concepts for which this organization, Empower Psychedelics, was established. But that is years down the road, and not until the very least we have established a strong precedent for this clinical trial work with the group therapy. And just as a summary, at the very end, this here explains the protocol that we have approved. So I'll just leave this up for a minute or so, and I'm happy to share this presentation with you afterwards. But yeah, I'll just leave it on this, and then I'll take it to the next slide, and then I'll let you read over it for a minute or so. And then that's it from my end. So then if anyone has any questions or wants to talk about anything at all, I would be more than happy to do so. And thank you again for having me and listening to me talk.
Thanks, John. Yeah, I definitely have some questions for you. And happy to open it up to everyone else too once you're ready.
Thanks so much, John. I have so many questions that you only have half an hour, so I don't want to dominate the whole thing. But I'm really curious about right now, like you're talking to a group of clinicians, so we probably have lots and lots of clinical questions, which I don't know if that's your wheelhouse, but it looks like you've done a ton of research on this, so you know a lot about your protocol. But I'm just curious, where are you recruiting first responders now, and how might, like, our patients who are first responders who might be good candidates for this study connect and sign up? And I have lots of other questions, but that was my first thought, is like, how could this benefit the people we work with right now? Yeah.
Thank you. Anyone interested in potentially taking part can either reach out to me directly via email, which I'll provide, and Kevin has it as well. And then also at our website, there's an open messaging portal to submit requests, empowerpsychedelics.org. I could share that as well. But we get all sorts of including Kevin reaching out to me through there. So anyone is welcome to submit information through there as well, and we can keep that all cataloged for when we formally do open up the scheduling and planning process, which as mentioned is going to be the first 2 quarters of next year. Recruiting, because we have a lot of connections in fire departments and within just the community around here, we had a lot of word of mouth that's gotten through, and just a ton of interest and excitement. It does need to be contained, of course, and there are criteria and as mentioned, scheduling and advanced leave approval from the doctor is required. So there's some of that to be considered, but we are also trying to go through unions and representatives that represent these organizations or speak for them in behalf of lobbying or other efforts. Because they have this caring interest for this group. There's a trust established there, and so by them also vouching for these psychedelic assisted therapies. As for example, we're trying to go through with Veterans Affairs and other provincial unions to try to get not necessarily approvals, but support for this as we take all of this subsequent information that we're gathering and empirical evidence, and absolutely kitchen sink anything that we can throw at Health Canada in the next couple of years. To try to convince them realistically that we don't have to do a 100+ person clinical trial, and that we can instead roll this out into some sort of legalized, as mentioned, probably opening up Section 56 to authorized prescribers in some capacity. it was what we were really hoping for, to complete this clinical trial and have that adopted straight away. And I know it's a moonshot and pie in the sky, but yeah, if our government is expecting, clinical trials, red tape, none of this is going to get across the finish line. And we've already seen organizations going defunct, and a lot of them are in a ton of debt. And I really don't see an addressable market that anyone's going to recover any of that anytime soon. So if our government doesn't help to float this and see that this is, technically solving a problem for them in some ways, then yeah, that we're all going to be drawing debt in a few years, unfortunately, and looking back at this missed opportunity. So I would say within the current government, there's a ton of support for this, and that also within these unions and from these voices that represent these first responder groups, there's already a ton of support and backing for it. So if we stay on the course, then I can't see why there won't at least be a strong consideration from Health Canada for some sort of legalized effort for this group therapy for first responders. And yeah, that is really the goal and the outcome here. So the stronger the voice and the more support we have soon may help us push this over the line. Because the difference is if we complete this clinical trial next year and are having an adoption into a new prescriber scheme or effort through the government, we could start to see real legalized group therapies using psilocybin at the very least by 2027, which is really amazing, I guess, when considering the time frame of all this. But if we have to go through now 100+ person clinical trial, and then we're talking 2029, 2030, so the impact of not being able to have physicians and other medicine workers involved in this over the next 5 years is pretty significant. And obviously we'll continue to see this gray black market be the mainstay for all of this. And to be honest, maybe that is for the best if governments don't want to actually support this, and which would be extremely unfortunate. But as I talked about recently on the Maps Canada podcast, there is something inherently special about seeking these things out yourself and by your own means, and not through the system, so to speak. And so yeah, I think this is why we also see a lot of adoption of this from first responders. And we hope to see that continued support, but ideally through a legalized means.
I had a question that I was thinking about. The control in your study is active versus breath work. And I was curious why you didn't do active in both cohorts and like an individual treatment versus a group treatment. Has that already been done? Or it's kind of like that's what I'm most interested in, because the group thing strikes me as super relevant. Like almost every use of psychedelics ever is in a group setting. And the firefighter cohort is interesting to me also because there is a sort of a group setting in the firehouse. There's a support group kind of element to that cohort of first responders more so than others. So yeah, just curious why the control is on breath work versus psilocybin instead of individual versus group.
So we had originally looked at using placebo substances, and what we had found from other research works was that it was almost too obvious and just negated the effect of the entire clinical trial in general. And so part of the reason that we wanted specifically breath work and stretching was that we want to initiate this discussion of physical activity and psychedelics ASAP. And the intention was that by having at least a control group that was utilizing this, we could initiate that discussion and also gather evidence around the usefulness of these breath works and of just mind-body connectivity, rather than the use of a third-party medicine or a substance to intervene. And so that was the intention there. Although it's not to say that there couldn't be a more advanced analyses of this on a larger scale clinical trial, or even as we look into future legalized efforts of this. But I guess that's just a little bit of background if that answers the question.
So I would love to hear. I'm going to propose a little mindset shift here, because I totally see you're an amazing entrepreneur who's like pushed this forward and like done so much legwork to make this happen. And I'm so grateful that you're doing this in service of these populations that we all love and want to support. Let's assume success. It's all going through, it's all working. I want to hear your understanding from the perspective of a first responder. Like, what's their experience in this study? Like, if there's a first responder listening, what's the first thing they do? They send you an email? Do they need a referral from a physician? Do you have physicians on the team? Like, and then what happens next? And then what do they experience? And then what they experience? Because the people I'm talking to, they might be totally on board, but they also might really, really benefit from this, but they want all these questions answered. So if you could like describe the step-by-step process from the perspective of a first responder who's reaching out to you, that would be super helpful to me. Thanks.
Thank you. And thank you for the kind words as well. It really is appreciated. This, as mentioned, this has not been an easy endeavor. And so it's, it is kind words like that motivate me to keep doing this and that I'm doing the right thing. So thank you very much. I appreciate that. An email, an introduction. Yes, they would need clearance and a letter from their doctor to take part in the clinical trial, but that doesn't need to happen immediately. They would have a discussion with our team physician, Reg Peters, who was mentioned in the presentation there. And so once all approved and we have the scheduling organized, the group therapy program takes place once a week for 45 minutes online. And this is one of the powerful things that we have approval for here, is that the majority of this whole program takes place virtually. And it's only on the medicine day, or the very final day, that the whole group comes together in person to sit for the whole day together at this retreat center. So what they could expect is once a week on a predetermined day in the evening, they would have this 45-minute virtual sit in which it really quite amazing that the scope of what is covered through those sessions, but including breath work, including stretching, including group discussions about inner self and outer self, and connectivity to others and past experiences, and why are you here and what are you looking for, and there's a lot of that builds throughout the weeks, 8 weeks, and then on the 8th week everybody gathers in person at the retreat center, which is the one that we have approval for, is in Abbotsford, British Columbia. But as mentioned, should we pull this into a multi-site situation or a larger clinical trial in the future, they could expect that they would arrive at the clinic, which has been either approved by Health Canada, or maybe improved by Power Psychedelics in the future, should we pursue that avenue. But that's it. And then there are follow-up virtual meetings that take place in the subsequent weeks after the medicine day. And then there are longer term follow-ups in terms of the clinical trial that we currently have planned. There is an opportunity for patients outside of the province to take part. We haven't the money to cover everybody's trips and everything at this point in time, but if there was a significant interest to be a part of this very first pilot study, or the very first movers in Canada for this, we can accept patients to come to our Abbotsford clinic on that 8th week, and then all the other meetings would take place virtually prior to that. But then, as mentioned, ideally that there is an access and a clinic local to regions that first responders have this access to in the future.
Awesome. And then is there any Oh, hello to your daughter. Hello. Is there any follow-up afterwards? Like once they do to the retreat, go to the retreat, is there any follow-up integration in the protocol or anything like that? Thank you.
Yes, yes. So there are checkpoints at I'll have to confirm, but I think it's 6 weeks and 6 months, or sorry, 6 weeks and 3 months afterwards. Or I'll have to confirm. It might be 4 weeks and 3 months, but currently that's what we have planned as part of this clinical trial is 2 touch points after the full 12 weeks is finished.
Also, I mean, I read the protocol myself, and I believe, you can correct me if I'm wrong, but it's a 12-week process, 8 weeks prep work. The session itself is 2 days, 2 nights, and then 4 sessions after that, integration, and then you have checkpoints at whatever it was, 3 weeks and 6 months or something like that, follow up.
Yes, that is correct.
Thank you so much.
Yeah. I was also curious about the practitioners like adopting the protocol in the future, kind of like you said, assuming it's all good and approved. What's the training like for practitioners to adopt the protocol? Do you have any idea? Like the gathering groups protocol is kind of established, so do you know what that training process is like?
Right. So we have discussed that, and currently what we have in mind is that one team member from our end, either from the Empower organization or from gathering groups, would go to visit this clinic or site that would be potentially interested, have a verification process in which we would have on record essentially that we could then keep for future use, be it for clinical trial purposes or for established legal access in the future. This may also have to do with whether or not Canada opens up its scheme to be either for specifically authorized prescribers or for special access through clinical trials or clinical work. So that may depend on it in the future. But yeah, the plan at this point in time is that someone from our organization would veto the physicians and the site to be useful for this in the future. Yeah, because Health Canada won't do it themselves, and because they would still have to do the necessary site investigation for the clinical trial if that was the method. We hope that Empower as an organization can help to facilitate that as well, and are also looking at even being able to provide insurance to those physicians in order to complete this work.
So I assume what you're talking about there is approval of the site itself, but for training physicians that would want to get involved, that would, I would think, be a more kind of a multi-week process. And who trains the practitioners like ahead of that?
So right now that would be Peg Peters, who was mentioned in the who's the leader of the gathering groups organization.
Okay.
And so Reg Peters, our lead physician, is his brother actually. So there was a team effort. One's working in the legal realm, and one's working on the not quite legal realm, and we've all come together to try to do something with this. But so yes, Peg would either do a virtual or very likely in-person meeting that may even include going through a abbreviated version of the protocol together, and then ideally taking place in a sit that's currently going on with gathering groups in order to see the action in person.
John, I've actually been to a gathering with Peg Peters. It's a phenomenal experience. I was hoping that we might be able to get him as a guest as well. I'm curious about, from my experience, the sitters play a huge role in how effective the experience is in a group. And I'm curious whether you have protocols for the sitters as well as for the the physician that's going to be doing the prescribing and the facilitator that's leading the 8 weeks beforehand and the 4 weeks afterwards?
Yes, that's a very good question. I would say that there are, with quotations, standard operating procedures that gathering groups has for the sitters, and then also for the oversight coming from Reg and the physicians as well. So that's not necessarily openly available, but for those taking part in actually doing sits with gathering groups, or with our organization, yeah, that's all going through PEG, and has that information, and would be happy to refer him to this as a speaker in the future. He would certainly be interested.
He's marvelous. Yeah, he would be a great presenter, and a different perspective, because he's actually got here's what it's like to lead a group through. He's got some unique insights.
Yeah, and watching him do it in person, was inspiring and encouraging, and seeing how him and the group are able to manage people even going through extremely difficult situations, or challenging trips, so to speak. Yeah, definitely, gives me great confidence that this leadership group has what it takes to do this properly. And as you said, it's extremely important that the sitters and those taking care of the patients have a thorough understanding of what to expect.
One of the things that he spoke about being very concerned about is that in his approach, he wasn't doing cultural appropriation. And I'm curious how that respect for Indigenous wisdom is being reflected in the protocols that you're wanting to put in place. Like, is it possible to respect the culture that we're drawing on in doing these kinds of processes, and still have it be standardized and still have it meet Health Canada requirements and so on?
Right, that's really important, and I'm glad that you mentioned that. And I will say that gathering groups does make an effort at all of the sits, and particularly at the very first one, to have a discussion about the history of these medicines, about the land acknowledgements for where we stand, and to try to integrate the knowledge from the past, particularly in some of these breath work and integration discussions, prior to the medicine day, during, and also beyond. I would say that it's thoroughly integrated into the nature of the program already, and so I trust that as we do this through Health Canada and in the legal realm, that will be honored and continued, and I would expect that us as an organization facilitating this would continue to honor and respect that tradition, which is critical to the psychedelic experience in general. That we honor the past and those who have practiced with this to help us to get it to the stage that it is now.
I have a question that is personal in nature for you, John. This has been so much work, and I can see and feel the dedication that you have. I'm just curious about your why. Why are you doing this? Why are you leaning in so hard? What is your personal experience that's behind this incredible project?
Thanks. Well, I had worked in the cannabis industry for some time pre-legalization, with a variety of small grows, which became big grows, and then eventually with Tweed and then ultimately Canopy Growth Corporation, and went through that whole transition of what was a startup, so to speak, pushing for a movement, turning into a large corporation, which was quite awful. And going through that and seeing a lot of the waste that occurred, throwing away hundreds of thousands of beautiful plants which we helped to grow at the facilities here, just because of trying to raise shareholder value. At the time, it was I must say I was sickened by it, and decided that it was inappropriate, and it didn't feel how I felt about cannabis. And so when I began to become more interested and pursue the psychedelic experience outside of just cannabis, I was so fascinated with the transformative effect that it had on my brain and my body, that I simply, the desire to bring that to people became, that was it. It was like, well, I've got to do something with this. This is simply too awesome to not have some sort of involvement with this. But it took years to actually figure that out. Nigel and I had been talking about doing something together for actually 10 years before we ultimately landed on this project and what we're doing now. So I guess, well, here's my why now, definitely currently, this little one, hoping that, a better world for her in the future, people loving and respecting each other as a society in general. We may have strayed away from that Western culture a little bit, and probably need to go back, towards that if we want to, succeed as a species and not all kill each other and keep pursuing wars and the whatever military industrial complex that is obviously an issue. And so I hope that Empower Psychedelics can be a force for good in this world, not only establishing access to psychedelics for medical professionals, but also trying to push on unique use cases for psychedelics. My main hypothesis around psychedelics is with LSD and its use in physical activity and physical therapy. That's another discussion for another day, perhaps. But that was also one of the whys of starting this company, was how can I actually do this legally? We have a trademark on the name Running on Acid in both Canada and the United States. That is the code name for this project, this physical therapy using LSD. But of course, that is years away and a lot of red tape to clear. Discussions about having to do that in other countries potentially in order to get that going sooner rather than later. But that was a big why for me as well. Truly, I played high-level sports, international rugby and hockey, and was so blown away by the effects of LSD on my ability to perform and recover physically and be active and sustain energy, that I felt that was necessary to bring out into the legal world. The neuroplasticity that occurs at these high intensity physiological states is it, that's the best I can say, really, without trying to get more scientific about it. It's in these high intensity physiological states that includes high intensity physical activity, in which the necessary neuroplasticity can be achieved to entirely change your opinion about yourself or about trauma or life or experience or acceptance of death or what have you. There's some sort of forgiveness cycle that takes place at that edge of pushing yourself. So need to somehow put that into a scientific context that makes sense. But how do we get there? That's it's not an easy question to answer. And ultimately the answer was that we need to establish ourselves as an organization in a context that makes sense for everyone, and that context that makes sense for everyone is a group therapy program for first responders using psilocybin.
Was exercising my ability to sit in silence there, seeing if anybody else would want to chime in. I had another kind of question about the group protocol. I guess for anyone who isn't aware of gathering groups and that protocol, can you talk a little bit about where that comes from, like the importance of them and why you selected them as a partner to develop this protocol for the study?
Definitely. So they were referred to us. I'll just come back here. So they were referred to us by the Center of Neurology Studies. Gathering was looking for a organization that was operating in the legal realm to perform a clinical trial using their protocol. Their organization felt as if there needed to be another layer between them and the government so that they could continue to be operating in their current capacity, while also starting to push towards legal efforts. So we all sort of came together in this fortuitous circumstance where we as an organization were looking to make good on the fact that we wanted to expand access to psychedelics for medical professionals and to first responders, making perfect sense that the economics of the group therapy model and the nature of first responders working within family and group type communities, it all just made perfect sense. And then now we have all these partnerships that we see here as a result of that these groups coming together. And so our intention is that the Gathering Groups organization will continue to spearhead the clinical efforts and lead all of the physicians and practitioners that will be doing this group therapy program, as well as operating their own legal version of this in the future. And then us as Empower, working with academic institutions and other clinics to be able to legally expand this throughout Canada and then eventually other Commonwealth countries. And I guess to speak to the importance of gathering groups, I mean, I can't even put it into words. It's it's what they're doing is remarkable, and it's a shame that we can't use some of that evidence to bring to the government sooner rather than later, considering that they've already dealt with several hundred patients over the years. But it's not to say that they haven't helped to establish a precedent, and now adoption approval of this clinical trial towards the legalization efforts. So yeah, I really do commend everything that they have done to date and continue to do to support this. Yeah, and we will certainly do everything we can to make sure that they are honored and represented as we expand this in the future.
So you're saying they've been operating kind of in the gray market or the shadows for, I saw the stats. Yeah, they've been doing this for a long time, just not quite above board.
Yes.
Awesome. Yeah. All right. Does anybody else, are there any other questions out there? If there's no more questions, then I will say thank you very much, John, for joining us today and telling us all about the work you guys are doing. I appreciate all the work you're doing. I know that a lot of the people on this call appreciate the work you're doing for us and our clients. And yeah, I wish you all the best in the future. And if, like John said, if anybody has anybody that wants to reach out, can reach out directly through the Empower Psychedelics website. And yeah, and if anybody in the clinic or anybody needs any information, please feel free to reach out to me as well.
Thank you for having me. I really appreciate it. And thanks to everyone for the great questions and input here, and for the work that you're doing and interested in the space as well. This really is a team effort, and it's going to be many voices coming together to bring this out into the real world in a meaningful way. So thank you very much. I'll be happy to refer Peg, and I'll also make some other introductions. And anybody, if you want to reach out via email or anything anytime to ask questions or discuss more about the project, I'll be more than happy to hear from you. Thank you.
Thank you, John.
All right. Thank you, John.
Thank you so much, John. Thanks so
Thank
much,
you.
Kevin, for facilitating. I really appreciated it.
Yeah, thanks, Kevin.
Thanks, Kevin. Thanks, everyone.